Thank you so much, Quentin. I so appreciate it. And I will share a little bit about myself here shortly. But I wanted to start off by saying that, really just welcome everyone. It's just an honor to be here today with y'all. And I'm glad to be meeting with, FRYSC coordinators who do the work on the ground and given the critical role that you play in supporting students and families every day. And I recognize you are truly the connectors, right? And that you help families navigate resources as I've been learning more and more about the role that you do in Kentucky. And so today I will start by sharing an overview of the School Oral Health Partnership and what I have had the opportunity to learn about the work in Kentucky over the past year. So I'm really looking forward to learning from each of you today, your experiences and perspectives, and we'll go ahead and get started. And so as we get started, and you can go ahead, Quentin, to move to slide 2. I'd love to get a quick sense of who is with us today. And so if you haven't had I know that I have met Beth before, but I may or may not have met any else in the group. And so I would love if you could introduce yourself, if you want to do that in the chat. If you could share your name, your school, that you work at, and then and of course, I recognize that your role might be that of a FRYSC coordinators, but I just want to see who's in the room. And also you can feel free to share a single word, or an emoji that describes how you're feeling today as you join this meeting. So I would love to hear, and then I'm going to see if I can see the chat so I can say hello. I want to make sure. So thank you, Beth. I appreciate it. And do let us know if you're having some trouble accessing the chat to be able to share your information. And so what I'll do is I'll keep the chat open on my end. So if you want to continue to add that info. Hi, Lori. Nice to meet you. Thank you for sharing. And you're at West Marion and Calvary Elementary. Okay. And like I said, feel free to keep dropping it in there as you're exploring the technology today. So I'm just really glad that you're here. And Quentin, we can go ahead and go on to the third slide, and I'll just keep also, like I said, a post on the chat. So hi, Lily. Nice to meet you. And Lily, if you want to share where you're from. Um, and hi, Karen. So Karen is at Helping Hands. So I just wanted to, before I introduce myself, oh, thank you, Lily. I appreciate it. Nelson County High. And this is meant to be very informal because we want to make sure to have a conversations as we are learning from one another and the work that you do. Before sharing about myself, I'd like to share a little bit about the organization that I work for. And so I work, Healthier Generation is the organization. It's a nonprofit. And I just want to share about its role specifically in this work. So, as I mentioned, we're a national nonprofit, and we're focused on whole child health. And we support more than 57,000 schools across the country. So here in Kentucky, our work is longstanding, and it's what we call place-based, meaning we focus on building relationships and supporting what's already happening in communities. Our goal, of course, is not to come in and create something new, but really just work collaboratively with those that are in the state. We partner alongside schools and community partners And as I mentioned, we don't prescribe any solutions, but we focus on trying to strengthen all the great work that you're already, each of you is doing on the ground. So in this effort, we're serving as a convener and a bridge builder. And so we try to help connect partners and then also try to surface, maybe where there's some gaps and co-create a practical tool that supports schools, but not just the schools, but as well the work that you're doing. So that's the lens that we're bringing into today's conversation. And then if we can move to the next slide, I'll just kind of share, uh, just do a quick moment to introduce myself. So my name is Josephine Thomason, and I'm a national advisor for whole child health with the Alliance for a Healthier Generation. And my work focuses on partnering with schools and communities to create and support practical and sustainable approaches to student health. So in Kentucky, I've had the opportunity to work alongside districts and partners so far to better understand what's working, maybe where some gaps exist and how we can support schools. So, but for purposes of today's session, my role is really just to facilitate the conversation and learn from your experiences, and so that we can shape the work that's being done in a meaningful and realistic way to support the work that you're doing. So I'd like to briefly walk. So if we can go to the next slide, there we go, in terms of the agenda for today. So just going to share briefly how we'll spend our time together. I'll start with a short overview of the School Oral Health Partnership, which I just mentioned earlier. And then what we've learned from our work in Kentucky over the past year, because we've had a prior grant last year where we did some work. And then I'll share a few key themes in terms of what we're seeing across schools and communities. And from there, we'll shift into a discussion because I don't want to be talking the whole time. I want to just really learn and hear from you. So it's really important as we think about, what is our time going to be like together, and just hearing from your perspectives. And we'll wrap up with next steps and ways to stay engaged if you're interested, and I'm hoping that you will be. So if we can move to the next slide. I want to pause and share what took place in our year one grant that was funded by CareQuest. And it was work that was done specifically in Western Kentucky. So we had the privilege of working in Warren, in Graves, and Christian counties. And so what we did was we spent time listening through conversations. We had some focus groups and engagement with families, school staff, and then also community partners. So we had an opportunity to engage with all of those. And one of the biggest takeaways is that listening builds trust. And when families and school staff feel heard, they're more willing to engage. And then I see, Quentin, that the slide moved. So if you wanted to go back to slide 6. Um, there we go. Okay, great. And so as I was mentioning, one of the biggest takeaways is that listening builds trust. And then when families and school staff feel heard, they're more willing to engage and share what's really needed. So at the same time, access barriers are very real. That's what we definitely heard that loud and clear. So, for example, transportation challenges, and of course, these I'm probably preaching to the choir because you all know this stuff. But what we heard was transportation challenges. We heard about provider shortages, especially as it relates to even Medicaid, those that have Medicaid, limited coverage, which make it difficult for families to follow through on care, even when services exist. So we also heard clearly that navigation is a challenge. So families and schools aren't always sure who to contact, is what rose to the top. And what steps, need to come next, or how even the systems connect. So, and importantly, we saw that schools, and specifically also FRYSC coordinators, are already playing a critical role as connectors, helping bridge families to available resources. So this is really interesting because from someone who's coming as an outsider and just really learning about all the fantastic things that you're doing, and despite all these barriers and gaps, we're seeing some really positive things that are rising to the top, and that is the role that FRYSC coordinators are playing in the school. So and I got to learn that there's the word frisk and friskies, so that was quite interesting to me. So just wanted to share that. So what we found out is that these insights are really what led us to think about how we can better support the role that you'll do, not by adding any work, but by making coordination clearer and more accessible. So if we can go ahead to slide 7. So I want to explore, I want to pause and explore why this work matters, especially in your role as FRYSC coordinators. Schools are often one of the most trusted and consistent points of connection for families. But I've also learned recently that although schools are trusted, sort of sources, that can be different for depending on the family, right? So some may see it as a trusted source, whereas others may not. So it's very interesting. And then questions come to you first as the experts. And families, of course, rely on you to help navigate what's available. So in this work, schools aren't expected to provide oral health services. That's not the role. Instead, schools, and especially FRYSC coordinators, serve as the connectors, right? Maybe it's helping families understand, so thinking about that educational piece, as to where to go and how to access support in the communities. So what we've learned is that when that role is clear and they feel supported, coordination becomes stronger and access becomes more equitable for students and family. So that's the lens, once again, we're bringing into the conversation, right? We're thinking about schools. That's, where we have played a role. And then, of course, learning from you as the experts. So moving along to slide 8. So building on what we just discussed about the role schools and FRYSC coordinators play, I want to share a quick example of the work that's already taken place here in Kentucky. This is something that happened in year 1. So with support from CareQuest, we started by developing a resource mapping tool. And so that tool, which I've sent the tool, the mapping tool, over to Beth so that she can share that with everyone, and you're welcome to use it. The goal of that tool is really to help schools identify the oral health service that already exists in the community. So that work that we were able to achieve helped increase visibility and awareness. And it created really a strong starting point. But what we heard, and what many of you likely experienced, is that knowing what exists is only a part of the solution. So then the question is, the next step is really improving how those services connect and work together. So that's the work, that's where this work is headed in terms of the School Oral Health Partnership. So we're moving from simply mapping resources to strengthening coordination and then clarifying the roles, improving, really supporting those referral pathways, and then making it easier, of course, for families to navigate care. That's really the ultimate goal. So if we can move to the next slide. So thinking on that shift in terms of if we're going from mapping resources to strengthening coordination, this is where the School Oral Health Partnership comes in. And it really, the partnership is meant to be comprised of community partners, and most importantly, to include FRYSC coordinators, because really it's about working together. So it's really the structure that we're using to come together and create a practical tool. So our this partnership, we meet every month, and invite anybody that is in Kentucky doing work around oral health. We invite folks to be a part of that, and I'm happy uh, to. And I think Beth, if you can share out, when I send out the next invite, because I would love to have folks participate. So this graphic really just shows how we go about doing the work as a group. So we start by listening, which is what I'm doing today, and hearing from you, just really gathering those insights. And then we, of course, are connecting monthly. And then the goal is together to shape the practical guidance that you see there. And then to be able to, of course, be able to disseminate and use the tool that's created. The goal, so we want to be able to support anyone who might be working in silos, just bring them together. Beth, let's see if you're interested in participating. Thank you so much, Beth. I appreciate you sharing that. Um, and like I said, invite everybody to participate. So if we can go on to slide 10. Okay, so to make this more concrete and bring a greater understanding, I want to share a perspective from one of our partners who joined the partnership early on. And as we began talking about coordination, they named a few realities that they were seeing on the ground in Kentucky, so that even when services exist, access can still break down. They pointed to things like language barriers that make communication and follow up more difficult. And I will be curious once we go into our discussion shortly if you're seeing some of these same things on the ground. Um, and so the importance of respecting instructional time and building trust within schools was important, and the need for clear shared understanding around the roles and expectation. So what this highlights is that the challenge isn't just about whether services exist. It's about how well everything connects together. And so we're sharing this not as a conclusion, but just as a context. Because to help ground the work we're exploring together, we these are some important things for us to be aware of. And so it's exactly why coordination and clarity and partnership truly matters as we move forward. They always say that there's no I in team, right? It just all of us being able to work together is really important. And so, Quentin, if we can move to the next slide. So before we move into discussion, I wanted to briefly share how this work has been informed so far. So we've had a couple meetings with our partners, and which has been wonderful. And so earlier this year, we came together to really listen to understand what's working and where challenges exist, and where better coordination could make a difference, right? Just kind of touching on those themes I shared a second ago. And what we heard is helping to guide this work. And so I'm going to share a few key themes that to help ground our conversation that came from our last roundtable discussion. Um, and so somebody had a question in the previous slide. What did school mile mean? So could we go back a second, Quentin? Because this is great to have a actual. Okay. So if you wanted to come off mute and then ask.
So the last section says some dental providers in school mild not fully understand. What is
Oh, apologies. That looks like it was a typo. So some dental providers and schools may not fully understand.
okay? Okay.
Yes.
So my brain was reading it school smiles because
Uh-huh.
some of ours use school smiles, and I was like, are, Aren't they referring to school smiles? Because a lot of times school smiles doesn't fully understand. So okay, I was didn't know if it was meant to be mild, but it's May. Okay, thank you.
No, and appreciate you catching that. I absolutely love a detail-oriented person. So
Well,
you were just speaking my language.
I don't
And
know if it would have caught me if it wasn't so I have to be honest, if it wasn't closely to school smiles, because we've been work it's like my brain was like, was that supposed to be smiles? Um anyways, because we work with them on dental care and we're trying to figure out. So I won't go into that. I'm just gonna keep listening. Thank you.
no, no, and actually those, you just bring up a great insights. And so we're going to be jumping into the discussion here. So I would love to hear more about what you would like to share about
Okay,
the SMILE program.
okay,
Um, so actually, we're going to go ahead. If we go to next slide 12, um, I'm just going to share the themes that came up from our roundtable discussion, just so that you all are aware of them. And then like I said, then we can just go into discussion because really, like I was mentioning earlier, this is really all about you. I want to hear from you. It's not about me. I'm just the person here gathering the insights. And so here are a few of the key themes that came out from the partner discussions or conversations that I shared. So first, there are strong assets already in place, including FRYSCs, from mobile services to school-based coordination, community partnerships. We also heard clearly that schools and especially FRYSC coordinators are the trusted connectors for families navigating care. And many of the partners shared the same thing. And then we also heard clearly that at the same time that access can still break down, particularly around urgent care, communication, and then follow through. So I'm definitely, as we go into the discussion, I want to hear from you and see if that's some of the same things that you're hearing. One thing that did stand out was how much advocacy matters. And then, students often receive care because someone in the school steps in and help make it happen. And I have a feeling that you all are some of the ones who are really the ones stepping in to help those students. And then we also saw that coordination varies across regions. What's available and how systems work can look very different from one community to another. And then, of course, across all of this, there's a clear need for more consistent and clearer pathways so families and schools know exactly what to do next. So these insights are what we're building from as we move into the next phase of the work and as we hear from you today. So let's go ahead and continue on. And so as we move into the discussion, I want to open the space for you to share what you're seeing in your schools, in your communities. You can feel free to come off mute or you can use the chat. Really, it's whatever is most comfortable for you. There's no pressure to have a polished answer. So this is a very much an open conversation as your perspectives are critical to shaping this work. And so I may pause occasionally as I'm reflecting back what I'm hearing so we can start to notice maybe some patterns together. And if you notice some of the patterns yourself, feel free to elevate those. So we'll go ahead and continue on, and we're going to um, go into our open discussion and do our first question. So I'd like to start by grounding us in what already exists across your region. Okay. So Quentin, if you can go ahead and there we go. Thank you. So from your perspective, what school-based oral health supports are currently in place? So this might include partnerships with local providers. Maybe it's mobile services, referral pathways, perhaps school nurse initiatives, or it can also be education efforts. So really anything that connects students and families to care. Okay. So that's what we're going to focus on. And so we're beginning with strengths. What's already happening that we can build on? And like I said, feel free to come off mute. This is really meant for you. And your wheels might be turning as you're thinking about this.
So I'll go ahead and jump on.
Yes.
So I don't, I, in our area, it is really just the lack of um, options to refer our
Mhm.
students to. So I was joining to see if there was any insight on referrals for dental, because dental really, there's not great coverage for it. I kind of feel like we still perceive dental as a cosmetic. When I was a kid, I didn't have dental insurance my family didn't pay for that as a through their insurance. And so we paid out of pocket. And I can remember we always considered that being more cosmetic than required. And I feel like we still like that's still kind of how I perceive it as an adult in a way, just because even if a family has Medicaid and they say they have coverage, they really don't because a lot of providers will not take Medicaid patients, or they may say they take them, but they're not um, taking new patients, period. You know what I'm saying? They'll say,
Hmm.
so we have struggled with referrals to find someone to take. And I've been told that it's because the reimbursement rate is a lot of times why, dentists will not take Medicaid patients.
Mm.
I don't know
Yeah,
if anybody
great
else has
insights.
been in that kind of situation. In the only place we have, it takes like months to get into, which is a community dental clinic.
Mm.
So I like the mapping strategy and like coming together as a team, but I really feel like we're still going to kind of hit some of those roadblocks, like the lack of providers. The one provider that's available is booked months out. And then a lot of times we have to travel to like Louisville or Henderson, and then
Hmm.
run into the transportation barrier. And then we've brought in dental mobile units, and some schools have had great success, others have not. So we're trying to figure out like overall as a district what is the best approach. If it was a consistently across the board positive
Hmm.
feedback, but it's good feedback. It's just working through like it's not all bad. It's just working through the kinks that mobile units may have.
Hmm.
So.
And with regards to the mobile units,
Mhm.
have you been able to identify, why it's successful in some and not in
So,
others? Just curious.
well, one of the issues that, and so I jumped on because I'm really curious to learn about, resources, supports, and things such as that. I was a school that decided in the mix of everything just to kind of stand back and wait until next year. One issue was that you utilize their reimbursement, and then if they have to then go to a dentist, there was some reimbursement issues. And so I'm not real familiar because I wasn't hands-on, but that was one concern that I had, or not that I had, that I had heard.
Hmm.
Um, I had actually, oddly enough, nothing to do with work related. My son played basketball, and a dental hygienist so happened to be one of the players' mom, and she went on and on about the mobile units, but it was in the middle of a basketball game, and I can't really remember. But I feel like providers don't like the mobile units. But I need to like reconnect with her outside of a basketball game telling me, can you go through that again when I can take notes? So we're still trying to just understand how they can best support and make sure there's no um, issues when we then have to refer outside the mobile unit. Because I think the mobile unit's limited on what they can do.
Mm.
I don't think they can do everything.
Yeah, and that's a
Yeah.
that's a great question is, you're kind of looking at, the resource. What does the resource actually provide as you're sharing about the mobile unit? And it was interesting that you mentioned also in terms of, you know, what are the providers' perceptions of the mobile unit? right?
Yeah,
In addition to what it offers. And then just the perception of dental issues as a whole, in terms of cosmetic versus an actual need. So just really incredible insights that you have shared. Um,
and that is just my perception. Like, I still feel like we live in a time where it's considered more dental. It, I feel like it's still perceived as that, which it's not. It's just my perception of growing up as a child. That's more of a personal perception that I always saw that as not a required, like, we don't have to you can decline dental insurance.
mhm,
And so, and I know that we always did. And so, um, but we're really working hard to establish a good relationship with a mobile program and work through some of the things like, I guess that's just learning, like, what error did we make? Like, what happened with the reimbursement? Like, why is this a conversation? Or the follow up, who's responsible for, okay, you did the initial screening or you did the basic routine work of the cleaning and x-rays, and now they need to be referred. How does that refer? So we're just kind of like going through understanding the process and developing
mhm.
relationships and learning. So we're still so new at using them.
And that's helpful because what you're doing is you're identifying, what are some of the barriers, the challenges, and then it sounds like you're also sort of thinking about the solutions, right?
Mhm.
What is within, perhaps your locus of control, you know, for example, the number of dental providers available to support may not be within your locus of control, but what is, right? So I love that you're seeing, looking at both the challenges as well as potential solutions.
Yeah,
So
absolutely. I'd love to hear from the two that typed in the chat about the Miles of Smiles and Healthy Kids Clinic program. I don't know if they're just specific to their counties.
yes. And Karen, would you like to share?
Um, I'm not very knowledgeable about it. I just started working here at the beginning of the year, so I'm still learning about the programs myself. I do know that from what little bit I've learned, they don't charge the families. So I don't know how providers feel about that. Like I know when my daughter had dental work, I didn't let her see those people because she was seeing an orthodontist, and I was afraid, the orthodontist might not approve of somebody else doing something to her teeth. But yeah, so I'm just still trying to learn about all these different resources. So that's one reason I tried to get on today, was just to kind
Yeah.
of see what some other districts were doing.
So same position. So we're just starting to work with mobile units and learning and
Mhm.
also really trying to figure out how to best partner with the dental providers here in our community. Um, so I think we're all in I know I'm in the exact same boat as you.
And that's helpful.
None's
That's
negative. None of it's like a negative. It's just
hmm
learning.
yeah.
Like the communication between everyone, I think is our big thing. If we go with the mobile units, talking with the dental providers and making sure we're not, just don't want to mess anything up for a family. We
Right.
want to give them the child the care that they need.
hmm hmm And it's helpful to have your perspective as well as, new to this, new to your role. Um, because as we think about the work that Healthier Generation is trying to do, essentially we're trying to create a practical tool that you can then take and use it as part of your everyday work. So, for example, to your point, what are the resources available? How can we identify and a resource, right? So as I was mentioning, our goal is to create a practical tool that will help you follow sort of a step by step in terms of, oh, okay, this is we can use a resource mapping tool that's part of this practical, toolkit to be able to help our work. If that makes sense. So what we're doing is I love that we're able to hear what you're sharing today, so we can make sure that that's included.
So
Uh,
where do we access the toolkit?
yeah. So what we're doing, because we're in the initial phases, we're gathering the insights in terms of what you all need, as you're like as I was mentioning, as you're doing your daily work, and just where the goal is to co-create something together so that it is something that's usable for the schools. So as you work with schools, you know, everybody can be on the same page and have this same tool, and
Okay.
then able to follow it. So that's my goal, is just really to hear from you. What are some of the gaps? What are some of the challenges? And and then also what are, maybe it's even outside your county, that there are some best practices that are working
Oh, yeah.
to be able to address a very similar issue.
Oh, yeah, that'd be great to know some best practices from other areas. We might be, we might be on the path of figuring it out here
Mhm.
with some of our partnerships, since we do have some in the works, just working through the kinks. Like I said, none of it was, it's not negative, it's just figuring it out.
Absolutely.
Like they're providing a great service, but what happens if this happens? And then our community dental clinic, they're awesome, but how do we get them in sooner if we needed to? And then the other one was, so the mobile unit. Oh, and then working with our providers to have a better understanding, like who accepts Medicaid currently, you
Hmm.
know?
Yeah, so you can know what's available. You can
Yes,
the
yes.
yes,
So, and,
absolutely.
and like not saying anything negative to the dentist because they are not accepting and understand, like, all doctors, but who, instead of making 10 phone calls and find one, is they all take Medicaid if you look on the member service like
Hmm.
list for their insurance, and then you call and like they're not taking new Medicaid patients. So then it's like, trying to find. So it's just knowing what resources we have is going to be helpful.
Yes, understanding that why. I love that. And Lori, I wanted to give you an opportunity if you wanted to come off mute to also share, since I see that you included something in the chat.
So we have a contract through Healthy Kids Clinic that also does our in-house nursing program. So all of our schools in our district have a nurse full-time in-house. They also provide our dental services, and they've started doing eye care this year too. So they come around to all of our schools, and it's through Cumberland Family Medical Services, and they have a
Hmm.
mobile unit through them. So it is their providers coming to our school giving those services, and we have a direct contact with them, and we schedule it, and so they actually prep their work. They've already sent somebody. I have mine in a couple of weeks. And so somebody comes in one day at the beginning of the year. All of our students, when they fill out all the paperwork at the beginning of the year, it's also included in there if they would like dental care throughout the year. So they fill out all the paperwork then,
Oh,
and then the person comes in to work the papers. So she was in my office all day one day, and she called to make sure they had not got their cleanings. They did not see another, provider or anything like that, because, you can only see every 6 months, all that kind of
Hmm.
stuff. So she works it up. So now we have a list of all the kids that they're going to see. And when they come in, the students that she has picked out will see the provider to get their teeth cleaned. And then if they need any kind of restorative services, they will also do that while they're here. So she's going to be at each of my schools a day and a half to help with my students. And that's just what we do through that program.
Yeah, and thank you so much, Lori. And I'm curious, for those that have shared so far, how does this resonate in terms of what you're maybe hearing from Lori? And Lori, just also curious, as others have had the opportunity to share, if you maybe had some insights as well for them.
Well, our program is through like I said, through our Healthy Kids Clinic. And we're in Central Kentucky. And I know
Okay.
Cumberland Family Medical Group, if you're in our area, they will provide services through the schools. If it's approved, you have to go through the whole big process and stuff. But I know there are several schools that they provide services for, and it's Cumberland Family Medical Services.
Yeah, and Lori, as I'm learning about Kentucky, so you mentioned, and this is in Central Kentucky, right? And are there specific, do you know, is it specific counties that or that they're in?
I just know I don't know which exact counties they're in.
Okay,
I know there's several around here.
okay, all right, that's really helpful. Um, but there's a process, and then do you help, Lori, do you help the family through that process, or is there a
Yes,
specific
I
individual?
can. If they need help with the paperwork, of course, we can help fill that out.
Hmm.
If they need help with follow up and that kind of stuff. But now, when they're here that day, I will be solely theirs. I will help run, I will help do paperwork, I'll call parents, that kind of thing. That's one
Hmm.
thing that they want to have somebody in the school to be available for them those days. So
Wonderful, wonderful. Um, okay, so anyone else have anything else to share? Let me see. I'm looking at the chat. Um, and Karen, did you want to share anything else? Because I do see something in the chat.
I think it was Lori that was just talking. She said she was available whenever they were in the school. Is that correct?
Hmm.
yes, yeah, that's
Okay.
one of the things they kind of ask. Is that they call them a runner. So we'll go get students, we'll do that kind of thing. But if parents need to be called or, anything like that, we're just available to them.
Okay.
Thank you so much. So if we can go ahead and move on to our next slide, Quentin. I know our time is going by so fast. Oh, there we go. All right, so now that we've sort of surfaced what exists, I'd like to go just one layer deeper. And so when you think about oral health, who would you say are the trusted messengers specifically in your community? I know that, for example, Lori, would the Cumberland Family Medical Group be considered one of the trusted messengers?
Yeah, I would think so. And a lot of the parents, I mean, now they've been doing it for several years. So a lot of the parents just expect us to do this, and that's just what they rely on. So,
So when you say parents rely, so they rely not only on you as a coordinator, but also they rely on the medical group to make this provision.
right, yeah. They
Okay,
wait for us to take care of their babies.
okay, and that's fantastic because that just shows where that you've already built that trust, which is not always an easy thing to do, right? It takes time. So and I'd love to hear from anyone else. It could be, maybe it could be a health department. Of course, they've built a rapport perhaps with you as a coordinator. So um, anyone else who would like to share?
Well, I would just say I would reiterate the places that I mentioned, our community dental clinic and
Hmm.
our dental providers would probably be the best that people trust. And depending on if you needed the community dental clinic, then, they would definitely, I think, have that trust for their patients. And then our local dentist, the same.
Hmm.
I think the mobile units at some point, like you mentioned, the Healthy Kids Clinic, I think once it's established and we work through like just logistically and reimbursement and follow up, like kind of just making sure we're all good with the process, I think hopefully they'd eventually trust whatever program we bring into our district to provide that dental care on site. Hopefully they would trust us in our knowledge and the referral to that mobile unit.
And I have a follow-up question. When you mentioned the community clinic, would that be separate from like the health department as
Yes,
just trying to understand?
yes.
Okay, it is.
It's specifically for dental.
Okay, all right.
It
So
might be through U of L now, possibly. I think it may have changed over. I haven't referred a student this school year to the community dental clinic, so, but it is specifically a community dental clinic,
okay, okay.
which
That's
is
very,
great. It's just you could only imagine the amount of time it takes to get into one community dental clinic
yes, especially if you have a
because it's
large.
such a great resource.
Mm-hmm. Yes. Thank you so much for sharing. Anyone else? Just curious, when you think about like the schools, does every school have like a school nurse? And is perhaps school nurses also viewed as trusted messengers when it comes to like health information as we're thinking about oral health?
We do have a school nurse at every school in Lewis County, so we're pretty fortunate there.
And that's in
In
which county, Karen?
Lewis County,
Okay, thank you.
I think, yeah, and I think they rely on them a lot. I was just thinking, during this meeting that I need to go and ask her a lot of questions about dental because I'm sure she'll know a lot more than she can inform me on some of this stuff.
Hmm. Yeah, no, and that's great, right? Just looking at, who are being able to connect with some of these individuals. And what about, just curious, what about pediatrician or maybe faith leaders in your community? Are they considered trusted messengers?
Absolutely.
Okay, great. Um, and I think, as we think about this, it's really about, okay, how do we, sort of um, get the word out as it pertains to anything, it could be, here we're talking about oral health, but it could even be about food access, and being able to use all of those trusted community partners to support the work that you're doing. So thank you for sharing. And so we can go ahead and move on to our next slide. So thinking about what has surfaced around trust, I'd like to shift specifically to the partnerships. Um, where are partnerships perhaps working well in your region? So it kind of looks like maybe it's a strong coordination between schools and health departments or the community clinics, as you shared. In terms of like a seamless referral relationship, mobile providers being able to integrate into school systems. So, just where are the partnerships working well that you have seen? I know that uh, Lori, as you were mentioning that the Healthy Kids Clinic program, that sounds like it's a really good partnership that's working well with the schools. So just curious about, other partnerships.
So I don't know if if Lori or Karen, you said you were new. I know that we've started using, that's one of the mobile units, School Smiles. Like I said, I haven't started, but I
Hmm.
know I'd mentioned earlier, some have had great success with that program and some are still working out the kinks.
Okay, thank you for
I don't
sharing.
know enough to speak on since um, I haven't brought on an on-site mobile unit to my school yet. Hope to, but haven't yet.
Okay, thank you. No worries. Thank you, Karen. I appreciate you having joined. Um, so if no one else has any other, feedback about partnerships, we can move on to our next slide. So now that I'd like to gently shift to where maybe some challenges remain, and I know that's going to look different for everyone. So just wanting to learn, where do barriers or breakdowns occur? So just thinking about it from a different perspective, you know, when you think about students or families, where do they get stuck in the process? Could be the referral, it could be
Mhm.
follow-up, communication gaps. Where are they getting
Language, transportation,
transportation? Okay.
language barriers,
Okay.
understanding their coverage, how to navigate their coverage,
Mm-hmm.
finding providers.
And I like how you also shared, in terms of understanding their coverage, right? And what it includes, because some of the when you're in the health field, right, a lot of these things can be complicated, right? In terms of, even the language that's being used, right? Is it at a, readability level that the individual can even understand when just looking at a form? Um, for example, at Healthier Generation, we have another program in Kentucky. It's around vaccine confidence, and families are having difficulty with navigating the forms, and needing support for somebody to be able to walk them through filling it out. So I appreciate you sharing around the coverage. Anything else where you see, students or families getting stuck in the process? And maybe, some things won't necessarily come to mind now. And perhaps, as if you have a chance to think about these questions again, it's something will come to light. So we can go ahead, and if nobody else has any further, we can look at our next question, because I know we're running out of time. So now that we've talked about strengths, we've talked about some challenges, let's kind of look ahead. Um, so in terms of, where do you see opportunities for better alignment? So if we could improve just one point of coordination across schools and partners, where would it make the biggest difference if we could just improve one point of coordination? Especially what would be something that would be realistic? I know, because it's, some things out of our control, right? So we're just really kind of thinking about, in terms of a smoother pathway for families. What would that be?
Are you speaking in regards to oral health or just
Yes.
general?
Yes. So just thinking about, as we think about oral health, access to oral health, um, we're thinking about, points of coordination, right? As you're thinking about maybe those referral pathways, or it could be, something else. Um, just thinking about where there might be opportunities for better alignment. Because I know that, for example, earlier, thinking about, okay, how to really, understand, for example, how the providers perceive or think about things, you know, is it perhaps providing education on the importance of um, trying to identify providers, right? So helping, maybe it's a question of helping providers see, sort of at a larger level, what the concern is, for students and families as it pertains to oral health. Um, so just trying to identify, and if nothing comes to mind, that's okay. Because I know that we've touched on quite a few things so far, and I know also that we're at time.
Mhm.
So, what I would love to do is, kind of begin to close this out. And I will, sort of share a list of these questions individually or separately in a list. I'll share those with Beth so she can share those out to each of you. And but if you have an interest, you know, like I was mentioning earlier, we meet as the school oral health partnership. We meet once a month as the first Tuesday of the month, and if you're available, you get to hear from just partners in different areas as it pertains to oral health in Kentucky. And since what we're trying to develop is for you, we would love to invite you and hope that you consider being a part of the partnership. So I wanted to pause to see if anybody has any questions for me. What I'm going to do is gather, what I've heard today from each of you, your insights, and kind of pull those together. And my hope is to share your insights with our partners when we meet in April. And so I just want to pause just really quick to see if anybody had any questions for me before I closed out. Maybe you want to know more about the practical tool, when it'll be available. So I'll go ahead and pause.
Josephine, I would say definitely if you have a minute just to kind of talk about the practical tool and, as you said, when it would be available.
Yes, absolutely. So our project culminates sometime in August and September. So what we're doing right now is just really working with each of you and other partners to identify what are some, like I said, what are some of the barriers, and then essentially, whether we want to call it a roadmap. Maybe it's a roadmap that simply says, okay, you start here by mapping your resources, what you have available in your community. Then, if you identify that you want maybe communication, a component to this sort of roadmap or whatever it is we want to call this tool, the goal is to have essentially resources as part of this that support your work. So like I said, the practical tool doesn't have to be a single thing. It could simply have different components to it or different resources. Like I said, everything from our resource map that would be included, and a communication tool. So we just want to hear from you. What could you use if you had a magic wand? What would you like to see as part of this tool to make your work easier around as it pertains to around oral health? Because I know you deal with lots of different things, right? You're not just touching on oral health, but you work with so many different things. So, Karen, I'm interested in keeping in touch. Absolutely, we would definitely keep you in touch. And like I said, you all are invited, and you're welcome to join our next meeting. I'll make sure that Beth shares that out along with the questions. And please continue to keep ideating. If there's things you want to share out that you would like to see part of the tool, please just email, and we'll make sure to share that in our meeting. So it's been a pleasure, and I am just really honored to have been able to have a conversation with each of you today. So thank you so much. Yes, we'll be sharing, everything will be shared with Beth. Beth does attend our meeting. And I will drop my email in the chat. Actually, I'll create a follow-up email, and that way Beth can send you everything, so that I want to make sure I'm not overwhelming your email inbox. Thank you all so much.